got dinner, and I was sat down and I was sketching on a piece of napkin, and I was sketching, and this idea came to my mind that these resources exist, these communities exist, these opportunities exist. We have the ability to bridge these gaps. We have so many nonprofits. Denver actually has one of the largest nonprofit per capita in the United States. And that's crazy to me that even with all of these groups doing such valuable work, we were seeing so much disconnect. We were seeing so much disparity. So how do we bring them together, as a collective? And that's the Colectivo part, to attain peace and stability. And the you can't have peace without liberation, and that's the paz. Colectivo, the paz, a collective of peace. And we attain that peace through collectively liberating ourselves and collectively developing the strength and the resources and the tools for advocating for ourselves, to building that self-efficacy, right? And so we were sitting there, and I was having dinner, and I remember this idea coming to my mind, and then I knew I had to do something about it. So I was part of a leadership program at DU, and they gave us some funding, some opportunity to talk about this in a classroom. And I approached Claire first, and then I approached my friend Methuselah, who's the friend from the DRC that I mentioned. And then I approached a few other friends of mine, people that I knew were like-minded, who understood, had that lived experience, or had access to that, to people who have had that lived experience. And sitting down with them, we started kind of I want to approach this very systematically. And, I grew up with my grandfather, who was very inspired by the works that the Black Panthers did in the United States, the work that the Brown Berets did in the United States, and as well as the work that several community organizations and student groups did in India as he was growing up. And I wanted to, approach this with that mass line perspective. So we went out to the community. We did several community town halls. We did several community health assessments. We asked our community members, immigrants and refugees, underserved Denverites, who were facing this disproportionate brunt of an unequal system, how can we make it more equal? What does health mean to you? So we were asking the question that you're asking me. We were asking those same questions, very similar questions, to the people that we were living with. And so we were asking them, what does health mean to you? What does well-being mean to you? And we were writing down these answers. So I did a mixed methods needs assessment for a service area that includes 3 zip codes. And then we did several town halls. And after that, I brought together this group of friends and co-conspirators that I mentioned together, and we sieved through this data, sieved through the feedback we've got from our community and our own lived experience. And then we developed our bylaws, developed our mission statement, and then we started going door to door, canvassing, door knocking, trying to create more community buy-in for this idea, see if it would work, did it have legs? And it did. And it did. And in our first year, we were able to distribute upwards of 7,000 meals to unhoused residents of the city of Denver, our unhoused community members. We were able to distribute 7,000 freshly cooked meals. And that's not including the non-perishable meal packets that we distribute throughout the week. This is on the weekends when we cook and distribute. And then throughout the week, we distribute non-perishable food packets. We started doing street medicine. We started building after-school programs for our young people, especially people who had interactions with the carceral system. We started working with community advocates and community leaders and elders who have been working for a more healthy, equitable, meals at schools, who are working to expand food, EBT access for kids during the summer breaks, who are working to disrupt the school to prison pipeline. All of these people doing such valuable work. We were able to talk to them, work with them, build with them. And Colectivo currently, so our mission is to provide responsive resources and proactive advocacy simultaneously to underserved Denverites with the aim of creating communities of action. So that is what Colectivo aims to do. And we do this with 4 services right now. We have our mutual aid program that does our food distribution, our community kitchen, our street medicine, our hygiene kits, all of that great stuff. We have a resource navigation team that provides resource navigation, case management for unhoused immigrants and refugees who are needing for healthcare access or legal access and all of that good stuff. And then we have our youth program called USync, or Urban Scholars Youth Network. And we provide after school programs, we provide workshops in high schools about community organizing and community power building. We teach kids to make healthy food, healthy meals on a budget when you're using EBT food stamps to buy food. How can you still cook healthy, nourishing meals in like a 15-minute window? We teach kids to write resumes, after high school, what are their plans, pursuing 4-year college or 2-year programs, finding mentorships. We have a mentor-mentee program. So all of that in the youth wing. And then the last part of our service is our proactive advocacy piece, where we are advocating at the state capitol on more progressive legislation that can improve health equity for all Denverites. So we have been, so through these 4 pillars, we have been trying to address, get to the root cause of a lot of, disparity. And I would say with great success and very encouraging results that it's always so humbling to be a part of. We have helped upwards of 1,200 Denverites so far, and over the last year, we now distribute an average of 10,000 meals a year. So it's very, very encouraging and very exciting to be a part of.
I appreciate you sharing that, and kudos to you for I guess sitting down in the cafeteria that night and writing down that idea and then actioning on it for it to come to all of this great work. And firstly, I want to say because I think it's so important to share this story and share that perspective, because even if someone wants to do this on a small scale in whatever community they are, they have the means, they have the skill sets to do like the focus group, the needs assessment, understanding needs, to build a relationship with the people in the community and really find out what are the things that they need. And then that in itself is a public health work that you can be doing now as an independent project if you really wanted to. And then to that point, branch out, create nonprofit, creates whatever that might look like. But I'm just there's so much potential in there for so many of us to make that change. And firstly, I'm really glad that you all are doing all the food distribution and all of that, and like you mentioned numbers there. But the thing that's so important to me, and I think so often is missed from nonprofits and in this work, is while we do need to serve the immediate needs of the community, is how are we, to your point, doing that proactive advocacy so that we necessarily don't have to deal with this issue. Let's focus on another issue that the community needs, because we've gotten the policies, we've gotten the systems to change, to give those people the equitable access to those resources that they need. Yeah, this is awesome, and I'm really glad that you took this upon yourself to do this, and I think it's really meaningful, and I think this is what we need to continue to do as public health professionals, and with the skill set as a public health professional, to do more and